Hi, everyone. I'm in clinic. I wanted to go over something that is so commonly seen in rheumatology, primary care, and it is how to diagnose fibromyalgia. So, fibromyalgia is a diagnosis of exclusion. So, let's say that, I'm going to give you an example. There's a patient that comes in and they just have pain everywhere and fatigue and not feeling well, and they have no infection. The age appropriate cancer screens are up to date and are negative. And now they're in rheumatology and they've had an autoimmune workup, and there's no evidence of autoimmune disease or lupus, and there is no inflammation in the blood work. And then other things have been done, like complete blood count, thyroid testing, vitamin D levels. And let's say everything is normal, okay? So, what are other things that we look for? Could you have sleep apnea? Do you have unrestful sleep? Do you wake up really fatigued? If so, maybe you need a sleep study. Let's say you did that and it was negative. Then also, do you have a history of anxiety or depression? Do you have extra stressors going on right now? That could also lead to having aches and pains and just not feeling well overall when you are feeling fatigue, when you are depressed or you are anxious, you tend to have more pain. So then we would try to control that as well. So a lot of times fibromyalgia is diagnosed 90+% of the time in women, typically in the ages of 20 to 40 years old. And usually there's a family history, like a first degree relative, mom or aunt or sister with fibromyalgia. That's very common. So if everything is negative, then we diagnose fibromyalgia. Also on the spectrum is myofascial pain syndrome, or chronic pain or chronic fatigue. All of it is kind of on the same spectrum. And, that's how we go about diagnosing it. There's not one specific blood test, but there are many tests that we do in order to rule out other causes before we come up with that diagnosis. I hope this helps.